Good afternoon, everyone. Bonjour à toutes et à tous.
Hello, everyone.
Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la ville.
We're there to give you an update on the City of Ottawa's response to COVID-19.
And I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we will be hearing remarks from Mayor le Maire Jim Watson and Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique. Available for questions from the media, following the statements, we also have, disponible pour répondre aux questions des médias, nous accueillons aussi Councillor Keith Egli, Chair, Ottawa Board of Health, le conseiller Keith Egli, Président du Conseil de santé d'Ottawa, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Mayor Jim Watson.
Good afternoon, everyone. Bonjour à tous. Today's provincial announcement has completely blindsided Ottawa residents and small businesses who have diligently followed the rules. The province sets the rules, we follow them, and then they move the goalpost. We follow the new rules, and then they change them again. Despite the fact that we've had the best numbers of any large Canadian city, we are now facing a 28-day lockdown and will likely have a devastating impact on our local economy. When asked about the potential lockdown on Friday, Ottawa Public Health was not in support, as they did not think it was necessary at this time. Dr. Etches has always supported a balanced approach to controlling COVID-19 in our community, and she believes that we are still on that balanced path in Ottawa. Santé publique Ottawa n'était pas en appui de
Ottawa
cette
Public
décision.
Health didn't support
This
this
summer, Premier Ford's
decision.
government has put in place a system where regions were color-coded based on the incidence of community transmission, recognizing that one size, of course, does not fit all. The framework is based on local realities and relies on local data to make decisions for each health unit, and I very much supported that data-driven approach. As we face this provincial decision today, there are simply no facts to support a lockdown in the City of Ottawa. Il n'y a pas de données pour appuyer cette décision du gouvernement de fermer les
There's no
commerces
data
pendant
to support
28 jours.
this decision to impose a
Not
provincial
based on our
lockdown.
numbers or on the professional advice of OPH to the provincial chief medical officer of health. Ottawa registered 31 cases of COVID-19 today, compared to 611 and 480 in Toronto and Peel, respectively. Our positivity rate of COVID-19 tests is at 1.4%, amongst the lowest rates in the province, where Peel is at 8.1% and Toronto at 5.4%. We have fewer than 20 COVID hospitalizations. We're a city of 1 million people, and we've had no one in ICU for over 3 days. Our weekly incidence rate, which is the number of cases per 100,000 residents, stands at 27, while theirs is at 170 and 210. Now, despite these stark differences between our regions, we're all being lumped together in the same measures, which is complete overshooting when it comes to Ottawa. Last Thursday, the Ontario Hospital Association sent an open letter asking the government, and I quote, implement and robustly enforce a 4-week per 100,000 population or higher. Ottawa, with an incident rate of 27, is far from meeting that threshold. Today's announcement, unfortunately, goes back to one size fits all, and it punishes regions like Ottawa, where residents and businesses work very, very hard to flatten the curve for the second wave of COVID-19. That said, Northern Ontario is getting off the hook with a 14-day lockdown, which creates a double standard across the province. When the province imposed the closure of restaurants and gyms in October, we asked them to share the data that supported the closures. When they did, this data indicated very low rates of transmissions linked to restaurants and gyms in Ottawa. The province is now once again going down this path of imposing widespread closures without any data to support their decision. I can't reiterate this enough. We should always rely on data to make these tough decisions that affect thousands of small businesses and livelihoods in our community. Otherwise, how can we maintain public confidence in the public health guidelines that we've put in place, guidelines that residents and business owners have been diligently complying with for months here in the nation's capital? Nous devons continuer à utiliser les
We
données
must continue
locales
to
pour
use
que les
local
résidents et les
data to make
entreprises
sure that
continuent à avoir
residents and
confiance
local
dans nos
businesses
mesures
can
de
trust
santé publique.
the healthcare
Businesses
measures we
have
put
played
in
a key
place.
role in our fight against COVID-19, and once again, they're being treated like they're a leading source of transmission, which they're not. And now, not only is there no reward for the good behavior of our residents and business owners, I fear the overcrowding that will take place in the next few days as residents rush to stores and shopping centers across the city to make up for Boxing Day. I've been communicating these concerns to Premier Ford and our local ministers last night and this morning. I've asked them to reconsider their decision to impose a 28-day lockdown in Ottawa in recognition of our low numbers and positive trends. I believe they understand our situation, and I remain hopeful that they will reconsider this measure imposed in Ottawa in the coming days. Wherever they land, we'll have to live with the public health measures that are imposed on us by the province. Through these difficult times, I want to encourage everyone to support our small businesses by ordering takeout, buying gift cards, and getting local deliveries. Nous avons tout un rôle à jouer
We
pour
all have a role
continuer
to
à appuyer
play
nos
to continue
entreprises,
to support
nos
our
petites
local
entreprises et
businesses,
les millions
local small
d'emplois qui en
businesses.
dépendent. I'll
There
now
are
ask
many
Dr.
jobs that
Etches to say a
depend on
few
it.
words. Thank you very much. Merci beaucoup.
Thank you, Mayor Watson. Quay, hello, bonjour. Last week, I did connect with Dr. Williams, Ontario's Chief Medical Officer of Health, about the shutdown, which was announced earlier this afternoon. It was a possibility. We weren't sure which direction things would go. And I want to acknowledge the dire situation that much of our province is facing and how important these next weeks are going to be to stem the tide of COVID transmission across Ontario before it leads to unprecedented hospitalizations and cripples our healthcare system. It is clear that stricter measures are needed to control COVID transmission in many parts of our province. And in my discussions with Dr. Williams, I highlighted the incredibly hard work and significant sacrifices that Ottawa residents and businesses have made over the last several months to keep COVID transmission down. I also mentioned the important role that schools play in enabling people to work and in providing structure for children and youth days. Au cours de mes discussions avec le Dr. Williams, j'ai souligné le travail
During my
incroyable
discussions
et les
with Dr.
sacrifices
William, I
importants que
pointed
les
out
résidents et les
that
entreprises d'Ottawa ont fait
local
au cours
businesses
des
and the
derniers mois
population have done
pour
some
réduire la
major
transmission de la
work
COVID-19 dans
over the
notre
past
communauté.
few months
J'ai
to stop
également mentionné
COVID-19.
le rôle
I also
important
mentioned the
que
important
jouent les
role
écoles
that
pour
schools are
permettre aux gens
playing
de
to
travailler
allow people to
et
go
à
back to
aider
work
à structurer
and
les vies des
to
enfants et
allow
des jeunes.
children to have a structured day.
Through that hard work, and most recently this fall, we have seen the number of hospitalizations and outbreaks decline in Ottawa. While we're no longer in a decline, the levels of COVID in our community remain stable. And we know, though, even a small increase in the number of close contacts that we have can quickly lead to a significant rise in COVID levels here. We see our neighbors have higher levels now, and we see connections between our jurisdictions. We know our hospitals in Ottawa are ready. They're not seeing the worrying trends in other parts of the province, but they are working at capacity, and we want to see the elective surgeries continue and not be cancelled. I am disappointed with the decision by the provincial government to apply a 28-day shutdown on the City of Ottawa, and I've asked the provincial government to reconsider a two-week shutdown for Ottawa, one that would be as short as possible in consideration of the evidence of the COVID indicators in our community. Je suis déçue de la décision du gouvernement provincial.
I'm very disappointed by the provincial government's decision to impose a 28-day lockdown on Ottawa, and I asked officials to reconsider this choice for Ottawa. The measures put forward, the confinement, the lockdown should be as quick and as short as possible. We all know that lockdown has a serious impact on people's mental health.
We know that in a shutdown, we lose balance potentially in our mental health and the freedoms in our lives. And for people living with domestic violence, home is not a haven, but a dangerous place. Many business owners in the service industry are facing devastating economic impacts, and their livelihoods are at risk. Self-isolation and loneliness are having a severe impact on mental health. People are suffering, and everyone is tired. Les gens souffrent.
People are suffering and everyone's tired, I think.
Today is the winter solstice. It's the day of the year with the longest hours of darkness. Today in Ottawa, we're feeling that darkness. But the darkness comes and the darkest time comes just before the light. And I want you to know that we will continue to keep fighting for the people of Ottawa. We'll continue to keep speaking to the province to make it clear to make this shutdown as short as possible for the city of Ottawa. And today there is hope in our community. Last week, the province supported us to vaccinate nearly 1,500 long-term care workers. They received the first Pfizer COVID vaccines in Ottawa. And there will be a phased and scheduled vaccine campaign to make the COVID-19 vaccine available to anyone who wants it. So we're in the process of reaching out to all long-term care homes and retirement home operators and staff to continue to offer more doses of the vaccine. The staff who work at long-term care or retirement homes in Ottawa are asked to contact their employer today for information about how to book your vaccine appointment. Aujourd'hui, il y a de l'espoir dans notre communauté.
There's hope in our community. Last week, more than 1,500 long-term care workers were vaccinated in Ottawa. There will be a vaccination campaign which will be staged to make the COVID-19 vaccine available to all those who want to get vaccinated. We're currently contacting all long-term care workers to continue to vaccinate these people. Those people working in long-term care facilities and retirement homes in Ottawa should contact their employer starting today to find out how to get an appointment for a vaccine.
Ottawa, I'm proud of the work you have done. I know you're committed and that you care deeply about your community. In the days ahead, please do not gather with people that you don't usually live with. This Christmas must be different. Stay with the people in your household only, and if you choose to see family and friends outside your household, physically distance and wear a mask. Do as much as possible outdoors. Stay home if you're sick and wash your hands regularly. These next few weeks are important. Caring for your loved ones means doing these things. These are the simplest things, but they are hard to do, especially this Christmas. Je suis fière du travail.
I'm very proud of the work.
Je suis fière du
I'm very proud, rather, of the work that you've all done. I know that you've been committed and that you take great care of your own community. Please keep up the fight over the next coming days. Please only get together with people that you normally get together with. Christmas must be celebrated differently this year. We must act to take care of our loved ones.
But while being physically apart. And many people are struggling. They need you to check in. Your family, your friends, your neighbors, people who are struggling with their mental health, substance use, people who will need food, support, even a friendly hello. We want to make sure that no one is alone. Our community is all of us. So please connect with others to see how you can help bring some light to someone's world. Thank you. Merci. Nigot.
We will not answer all the questions from one company, so you have the right to one question and one follow-up question.
I'd like you to ask your question. We will now start with Jennifer Beard at CBC Ottawa. Do we have Jennifer Beard on the line or anyone from CBC Ottawa?
Hi, this is Priscilla Huang for CBC Ottawa. I believe I will be the spokesperson for our newsroom.
Perfect. Go ahead.
Okay. So our hospitals are nowhere near Toronto's capacity situation. In fact, today we had 0 COVID patients in intensive care. So coming out of the lockdown in October was really rough for Ottawa's small businesses as we've spoken to them. Mayor Jim Watson, how do you respond to our city's business owners who are put on and off lockdown measures, some of who are forced to close, some of whose livelihoods are at risk, and what can you do for them specifically heading into this lockdown?
Well, thank you, Priscilla, for the question. I share the frustration of a lot of small businesses who, many instances, are hanging on by their fingernails because of the pandemic. But at the same time, the business community, along with the residential community, as Dr. Etches pointed out, have been working very, very hard, following the rules, only to be surprised and, as I said, blindsided by the province. The first I heard that we would be included in this this lockdown was by media reports over Twitter last night. So what I've tried to do over the course of the last 24 hours is advocate for the best case scenario is that we remain in the same status, because that is a recognition that we are following the rules and doing a very good job at it. And if that was not possible, at the very least, put us on the same level plateau as Northern Ontario. Why does Northern Ontario get a 2-week shutdown and the rest of us, particularly Ottawa, that has very low numbers, gets a 28-day lockdown? So that pitch has been put to the Premier and the Premier's office, and I hope that he listens to us, and I hope to have some response back, ideally in the next day or two, with respect to making sure that we're recognizing the good behavior of our businesses and our staff and our hospitals and our healthcare workers and the citizenry of the nation's capital. Thank you.
Okay, and I do have a follow-up if I can go ahead. So Mayor Watson, it sounds like you're in strong disagreement with the province as well as Dr. Etches here. And it seems like, you know, back in October, it was the same story where we were advocating for something else for Ottawa. And again now, and what if this happens in the future? Like, what will you change about the way you communicate to the province a week prior to their decision, if anything, in advocating for our city?
Well, the best tool I have is the behavior of our residents and businesses and the statistics that come from that behavior. It's very good. You know, we're the largest. CBC, in fact, reported, I believe, last week, a story by Joanne Chianello that showed that Ottawa had the best set of numbers of any large urban center in all of Canada, not just Ontario. So we're proud of that. We recognize that, you know, these things can turn on a dime, and we may have a whole series of bad numbers. And I'll be the first to go forward and say, all right, our numbers are heading in the wrong direction and we need to be stricter. But at this point, they're heading in the right direction. And, you know, I continue to argue that case with my colleagues at Queen's Park. I've had a very positive relationship with Premier Ford, and we get along well. But this is a fundamental disagreement, and I don't believe that we should be penalized because of the challenges in the GTHA. Thank you.
Thank you very much, CBC. We will now go to Alex Gouge at CTV, City News Ottawa. My apologies.
Hello, this is for both Mayor Watson and Dr. Etches. So given the very low cases and improvements we've seen in the capital recently, do you think that with the lockdown incoming, that it will create some frustration and less leniency to follow the rules in terms of COVID restrictions towards the public?
Dr. Etches?
Well, I think it's important to remember that the public health measures that are being put in place are not a punishment. They're to control COVID transmission, and that is important. The lower we can bring the level of COVID in our communities across the province, the better. We can avoid hospitalizations and deaths, and really an impossible situation where our healthcare system cannot continue with the other life-saving services it needs to provide. So, you know, I think, you know, hopefully people understand this is a temporary measure. As the mayor said, you know, if our numbers continue to be positive, we'll be able to go back to a more balanced approach. We need to make it through this dark period, and you know, I think people in Ottawa have been supporting each other through this. We need to make a couple more weeks, and you know, I think that will get us past a period where the rates have been rising all around us, and you know, keeping in mind it is for the protection of everyone.
And if I could offer a comment, Alex, obviously the small business owners that I've heard from and employees of small businesses are quite upset. I think you see that on social media. You know, they're They're at wit's end in many respects because, as we've indicated, we were told to continue the work we're doing because it was working. And I think our staff and public health and the great leadership of Dr. Etches has really helped us get through some pretty rough weeks over the last couple of weeks. So they're angry and they're upset and they're just frustrated because they don't understand why we would be lumped in with the GTA and Peel and Toronto. And I empathize. Look, at the mayors of those cities are friends of mine, and I don't wish that upon anyone. But the fact is that we're actually doing better, and that's something we should be proud of, not boastful of, because the numbers can change in a New York minute, as they say. But at the same time, I think it's patently unfair that we have to get lumped in with those areas that aren't doing so well. And what's even more bizarre is why Northern Ontario seems to have the ear of the government for only 14 days, when in fact, I think we're doing very well here. We should have been at the worst case scenario, kept closed for 14 days, ideally kept open at the same level we are, because I think those numbers show, as I mentioned in my remarks, that they're all going in the right direction. Thank you.
And that's my only question I have. So thank you so much.
Thank you, Alex.
Thank you, Alex. We will now go to Ted Raymond at CTV Ottawa.
Hi, Mayor. This question is for you, and I suppose we could ask Dr. Etches just about it as well. So, given the unique situation that we're in Ottawa, with many people living on either side of the river between Ottawa and Gatineau, and the province saying that if you come to Ontario during the shutdown period, that you have to quarantine for 14 days, what do you know about people who work and cross the border on a daily basis between Ottawa and Gatineau? What happens to them while our regions are in lockdown?
Yeah, I'm not familiar with your comment, Ted, that there's a self-isolation required or quarantine within Canada. I don't believe that's correct. I'll ask Dr. Etches to comment on that in just a moment. There was some, during the previous conference, there was some information where he talked about Quebec was flooding Ottawa. We have no evidence of that. There's, to the best of my knowledge, and I confirmed with Tony DeMonte, our head of emergency management services, we don't have any hard evidence at all, any evidence as to whether there's a spike in people coming over from Quebec to the Ottawa side or vice versa. So, in terms of the quarantine of going from one province to another, I'm not familiar with that. Dr. Etches may have some comments. She keeps in touch with the public health officials in the
We are just hearing about the details of this, and so we do need to look into those specifics if that is being put forward. I think that we've all along through this pandemic recognized that we're a national capital region, and the situation on both sides of the river is very similar. People going back and forth. This shutdown will align, the access to business will now be the same on both sides of the river for a period of time. And I'll continue to communicate with our colleagues on the Gatineau side if it does look like we need to take additional measures. But I still, again, I do need some more clarification if the province is looking at something more restrictive related to travel.
And if I could just mention one other point, the dates don't line up. They're not parallel. For instance, we believe the Quebec lockdown ends on January 11th, and our 28 days would be approximately January 21st. So even the numbers don't balance out one another. You'll have Quebec out of its province-wide lockdown, 10 days before our lockdown ends on the 21st.
Okay. Well, I appreciate that. Yeah. So I'm going from the document that we received earlier today from the province, just regarding interprovincial travel, saying that individuals and families who arrive or return to Ontario during the province-wide shutdown period should self-isolate for 14 days upon arrival. So that's the information that I have from the province, which prompted this question. Okay. My follow-up. Oh, sorry. Go ahead.
I was going to say, I think The challenge with that is the logistics. As you pointed out, there are thousands of people that cross the border because they have work assignments, healthcare workers, healthcare professionals that work in Gatineau and live in Ottawa and vice versa. So I'm not sure how practical that suggestion is, to be perfectly honest.
Okay. And my follow-up, you mentioned that you were blindsided by this and you learned that Ottawa would be included in the 28 days from media reports last night. Have you talked to Premier Ford about this lockdown, or what kind of conversations have you had before this was announced with the Premier and with the CMOH?
Yeah, my chief of staff was in touch with the Premier's chief of staff, I believe, last night. This morning, I had a conference call with the Premier's office, as well as Minister McLeod and Minister Fullerton. I've texted this morning and this afternoon with the Premier as well. And we laid out our case, just as I did today, to you and to the public and to the media, that we feel that the imposing of stricter guidelines on Ottawa when Ottawa's numbers are all going in the right direction just didn't make any sense. And I felt it was my responsibility to speak up for the residents and the businesses and the employees who are going to be
Sorry, Mr. Mayor, you cut out a little bit there.
Well, yeah, I'm just saying that a little bit. What was the last thing you heard? I'm sorry, I'm going to repeat everything, but I basically said that I felt it was my role and responsibility as mayor.
En résumé, c'était mon rôle et ma responsabilité en tant que maire de travailler avec Santé publique Ottawa, avec les services d'urgence, avec la Ville d'Ottawa, et de m'exprimer contre le confinement de 28 jours imposé par le ministre de l'Ontario, étant donné qu'on a de bonnes statistiques. Le médecin en chef a communiqué avec le ministère de l'Ontario. Alors, on nous a demandé notre opinion par rapport à ce qui était une exigence ici à Ottawa. Alors, nous savons que la situation est fluide. Nous sommes interreliés avec la province du Québec, avec nos voisins de Gatineau. J'ai aussi mentionné l'importance de maintenir des services de garde pour les enfants et d'essayer d'avoir un environnement beaucoup plus structuré pour les enfants. Merci. Merci beaucoup. Craig Lord, Global News, allez-y. Alors, Dr. Williams a parlé aujourd'hui. Il s'agissait d'un confinement préventif et non pas d'une punition pour la Ville d'Ottawa. Dr. Etch, percevez-vous une valeur à limiter les déplacements entre Gatineau, Ottawa, entre Toronto, Ottawa, afin de maintenir cet équilibre, car il y aurait des déplacements lors des fêtes dans ces régions? Si Ottawa était la seule région dans toute la province d'Ottawa à être ouverte, il y aurait peut-être un risque. Lorsqu'il y a davantage de mobilité, lorsqu'il y a davantage de rassemblements entre personnes, il y a un risque accru de transmission de la COVID-19. Dans les prochaines semaines, les gens se rassembleront éventuellement. Le potentiel est là. Je sais que les résidents d'Ottawa ont travaillé dur pour essayer de limiter les contacts. Nous espérons que les gens vont faire de leur mieux lors de la période des fêtes et nous allons poursuivre sur cette bonne voie. Question complémentaire? Directeur général de Monty, la question est pour vous. Est-ce que vous avez entendu ou quelqu'un ici a entendu si on était pour avoir des modifications? Parce que pour l'instant, on limite les rassemblements, les foyers, et on essaie d'essayer de limiter le nombre de visites. Alors, je vous dirais que Les élus
we're not going to be going knocking on doors and asking and looking for people, but we will respond to complaints and then enforce the
On va
regulations.
réagir aux plaintes et on va appliquer les règles. Alors, comme c'est souvent le cas, pendant la pandémie, ça prend quelques jours pour que les règles soient rédigées, ensuite réparties aux agences d'application. Alors, le diable est dans le détail, donc il va falloir voir ces règles, qu'on consulte notre équipe juridique pour comprendre donc ces règles, mais je pense que ça va se faire pendant les 2 jours à venir. Merci beaucoup.
Thank you very much, Craig.
Merci, Craig.
Annie Rose a le droit.
Oui, bonjour. Ma question s'adresse à Madame Etchez. En fait, je me demandais, avez-vous l'impression que le gouvernement y est allé un peu avec la facilité, en prenant pas en considération la situation précise de la région, puis en séparant seulement là, le confinement avec le nord et le sud de la province?
Je ne sais pas pourquoi, mais c'est un peu plus difficile pour moi aujourd'hui de comprendre votre question. Je pense que vous avez demandé si le gouvernement a pensé à une approche régionale.
Oui, voilà.
Et je pense qu'il y a une différence entre le sud et le nord. Alors, il y a un aspect régional là dans cette différence. C'est pourquoi la maire est discutée peut-être on peut être un peu plus comme le nord en comparaison de le sud. C'est une discussion qu'on peut avoir encore avec la province. Mais c'est clair, c'est difficile de juste prendre une décision, une unité de santé publique à la fois. Nous sommes toutes connectées.
Puis en sous-question, j'aimerais savoir, est-ce que vous croyez que le gouvernement est ouvert à faire marche arrière? Est-ce que vous avez espoir qu'il va faire marche arrière?
Oui, je pense que c'est important de continuer de regarder nos chiffres, mais oui, s'il y a une diminution dans le COVID-19 dans notre communauté, j'ai l'espoir.
Merci.
Merci beaucoup. Nous allons maintenant passer à Pascal Vachon.
Oui, bonjour. Ma question est pour le maire Watson. Vous avez dit un peu plus tôt en anglais que vous ne comprenez pas pourquoi M. Ford a dit que les Québécois viendraient en masse si jamais Ottawa resterait ouvert et que le Québec serait fermé. Est-ce que vous pensez que M. Ford a des données différentes que les votes? Selon vous, d'où sortent ces chiffres-là que ça pourrait arriver?
Mais par exemple, Pascal, Gatineau est dans la condition rouge maintenant. Et on ne veut pas une grande